Hello, I'm Ruth Hanston, and I'm here to talk to you today about two things that you can do to help improve your patient experience in your organization. But first, I'd like you to get a pen and paper ready because at the end of this short conversation, I'm going to give you a telephone number that you can use to help get some more information about how you can compete in value-based purchasing. First of all, I'd like to tell you about a couple things that we're seeing as we work with organizations nationally. Number one is that oftentimes there's confusion that service orientation might mean that people are actually paying attention to what the patient and family's clinical needs are, and that may not be the case. For example, people can be very kind and service-oriented, but unless the RN knows how to use the expert practices to help the patient and family focus on their short-term or shift-wise goals or priorities or things that are most important to them, and also their long-term needs and helping them navigate through the healthcare system effectively, your patients will not be extremely satisfied with their care. So that's number one. Number two, we notice that oftentimes that the team members are not working together effectively. For example, even though all your staff are very caring and they may also be focusing on patient and family goals, they may also be working in what we call parallel practice. And in that case, the care does not appear coordinated, or it doesn't appear that you're talking to all the disciplines in the care that's being delivered. So for example, from the patient perspective, if the nursing assistant is drawing a blood glucose and checking it through a chem strip or something, and they look concerned, they're not absolutely sure whether or not that value is being reported immediately to the registered nurse who would adjust insulin dosage or perhaps be calling the physician. What we advocate is that RNs and nursing assistants are together and plan the care that's being delivered together during shift report at the bedside. And also that there are interdisciplinary rounds being done each day so that the patients and families can be engaged in their care process. So two things. The service orientation has to go beyond that to actually focusing on long and short-term goals for the patient. And secondarily, that the team works together effectively, the interdisciplinary team and the RN nursing assistant team. So here's that phone number for you. It's Kathy Watkins at 773-224-6999. That's 773-224-6999. Our experienced team will do online and on-site observations to help you identify what's getting in the way of those best HCAHPS scores. Thank you for joining us.